areata, which is an autoimmune disorder, sometimes we can get the hair to grow back. So the answer to your question is depends on the reason for the hair loss. Any other? Yes?
Can temporal hair loss be reversed?
Again, depends on the type of hair loss. Because if it's caused by telogen effluvium, it will be reversed. If it was caused by a crash diet or a surgery or childbirth or something like that, that temporal hair loss caused by telogen effluvium, it's reversible. But if it's the androgenetic alopecia, which we talked about, or the female pattern hair loss, it will not be, you can improve it with the minoxidil, but it's not completely reversible.
So minoxidil is not only for the crown of your head?
Oh no, you can use it anywhere. It's just that the studies were done that way, and that's why the company can only market it in a particular way. But yeah, you can use it all over your scalp.
Why would you use 2% when you can use 5%?
Absolutely. I always tell my patients, we know 5% works better than 2%, so why use 2%? But in women, they're a little nervous, and sometimes we start them on 2%. The one thing you have to worry about with minoxidil is that you can develop facial hair. And in women, it's an issue. So they have to make sure they apply it and it doesn't touch their face, because sometimes they go to sleep and it rubs their faces and they'll get little fine hairs all around their face, and that's been an issue. Excellent question, and I did not mention that. She says, if you stop using the minoxidil, will you lose all your hair? The answer is yes. What happens is that the minoxidil is stimulating that hair follicle to keep it in place and to make that hair thicker. If you stop, it's not that you'll lose more hair, but you will slowly go back to where you were, because remember, it's a genetically predisposition, and you have your gene there, and that's we're not there yet. You know, there's a lot of stuff going on with gene therapy and transplants from other, from different donors and everything, but that's a problem. Shampoos, first of all, you should use gentle shampoos. You don't need to use a lot of those real sophisticated shampoos, and I would go with the big brands that I know, because I've worked with Dove. I launched their hair care line a couple years ago when they developed all their Dove hair care products, because they're usually a skin company, and they did like 5, 6, 7 years of research in their shampoos. The L'Oreal shampoos are very good. And if you're really concerned about the texture of your hair and you want to have a lot of improvement, there's some salon lines. They're a lot more expensive though, that have some specific products that sometimes are a little better, the ones than the ones you find in your supermarket and in your pharmacy, just because they put a lot of more expensive ingredients and silicones and softeners and things like that. But milder shampoos are better.
Does biotin work, or biotin?
Very good point. Biotin, I recommend my patients, all of them, we know, and there's some science out there, that biotin can help your hair and nails. So biotin is one of those good hair vitamins, and you can find them anywhere. When a lot of my patients that have significant amount of hair loss, and a lot of them that are associated with iron deficiency anemia,